I have several questions to Dr. Martirano's report. Can we revisit that, or do I just make it part of my report?
Why don't you contact Dr. Martirano afterwards if you have more questions, and then if you have a specific report, you can do that now.
Well, I think my questions are the concern of the community, and I think it would be helpful for it to be done publicly rather than by a phone call. Just a couple of questions about about his remarks. I didn't get to the raise hand in time.
Okay, please go ahead.
The first question regarding the Parks and Rec and Columbia Association, was there a thought to why they're not using some of their facilities for this? Or why they're using, they do have.
Yeah, Mr. Washington, are you here with us?
I sure am, sir. How are you?
And Mr. Gist is with us as well. We have all been working in collaboration to provide the best support to our families, and those discussions have occurred in partnership, and I'm going to ask Mr. Washington, who was a part of those conversations, directly. Go ahead, sir.
Good afternoon, Scott Washington, Chief Operating Officer. And thank you for your question, Ms. Catronio. I think the major piece of this is the fact that, as you know, that was presented back in July 9th. We had talked at that time the fact that child care services were going to continue to be presented in our facilities. And we actually listed the facilities, or actually listed the number of locations that we would have had in the spring, and trying to work with these same communities in the fall. Childcare is a priority of our policy, and we consistently work with these organizations to do that. So with Columbia Associations, Recreation and Parks, Head Start, also our school employee program as well. They consistently use our buildings, and we work with them on those. Are there any particular questions that you have in regards to their programs or safety concerns, anything like that I can answer?
Well, I guess it becomes complicated because we want to bring in our own people into this. I don't want to say own people, but students back into the building,
sure,
staff in their classrooms. And so it does complicate it because that is our priority, is educating our children, especially our neediest. So I understand the need for childcare.
Sure.
I understand other counties are doing this also. But I feel like we haven't prioritized the small group instruction, getting a plan in place. Suddenly we have this already in place, and it looks like we're not prioritizing the education of students ahead of the childcare or the daycare. And I guess I want clarification that this is not going to impact our ability to bring in students for small group and face-to-face.
Mr. Washington, let me take that.
Sure.
In no way should these be viewed as competitive in creating concerns for each other. I listed a whole series of programs in my report that we are trying to provide support to our families and our students, and making certain in no way that they should be viewed as competing variables. We're trying to implement them all in a very logical, sequential way around a series of criteria so that we can do all of those at the same time as we push in. And my comments alluded to the fact, as we build into a hybrid model, this will provide the foundation for us to push in. And so we have given great consideration to those, that they're not competing, that there's no concern regarding the issues of safety and jeopardizing the safety of other programs that are in the building at the same time. So if I didn't make that clear in my comments, I wanted to make certain that I provided that information again. We believe we can do these together, and that one is not taking priority over another. I also provided information to the board that stated that we would have more information about our thoughtful deliberations on how we would push in to provide small group instruction, and we will continue to provide that update to the board. But if I created a concern in my comments about the prioritizing, we are looking at ways to prioritize and move things in as we develop our process for moving to a hybrid model. Mr. Washington, go ahead.
And also, Ms. Catronio, I want the public to understand it, and as Dr. Martirano said, this is a very extremely limited scope in the child care facilities. As mentioned before, in the spring before the break, we had 52 facilities that were being used. Right now, that 52 facilities is down to 29. And just to kind of give you a scope of this, you're talking about basically 26 kids in a building with 4 to 5 staff, 26 children. That's it. And basically, so what we're looking at is the fact that, and kind of about guiding tenets on the whole piece was, number one, we did not want to exceed what was offered in the spring. We had 52 in the spring, we have 29 in the fall. Number two, we want to make sure that our priorities as a school system have to basically take precedent over the needs of those systems. And they've been told that. That's why one of the reasons why that has been so scaled down. But I think the third piece about that is, of course, the health and safety protocols. Each organization has had to submit their own set of protocols that are in compliance with COVID guidelines so that they can ensure their own health and safety. But I think, again, the key is you're talking about 26 kids in 29 buildings.
And the public should know that, I mean, the protocols are pretty strict. I mean, the parents don't go in the building. There's drop-offs, there are temperature checks. It's very intense. And so I know that it's completely different than having class. But I think there is just a lot of anxiety that.
You have another question, Ms.
Okay, yes, I actually do. I wanted to, Dr. Martirano, you mentioned the small groups that would be brought back in. Is there thought to CTE students or ARL students being brought in as part of that small groups, and then English language learners? You didn't mention those groups, and I just wanted to see if they were included in the.
They are part of what we have in motion right now. And let me enter it back into the record. We are looking at the limited childcare opportunities, special education services, support for teen parenting programs, counseling and other mental health supports, the fall administration of SAT, ACT, and PSAT, meal distribution, support for homeless students, and as I stated, other opportunities that arise, and the categories of which you just mentioned are a part of that. We are trying to build all of this in a way that maintains the level of the guidelines, which you just already alluded to. So yes, ma'am, that will be.
Okay, thank you. One quick question. Any thought as to a timeline for when the public can expect to have more of an idea of when we're going to start the small group?
That is under, as I had further previous communications with the board, I have appointed during our last presentation, Mr. Bill Barnes, our Chief Academic Officer, to convene an internal work group. He is in that process now. And if Mr. Barnes is on, he can give you.
Is he back from vacation?
Data. I don't think he is, and that's why I was proceeding delicately there. I will get a written update to you where we are with that progress, but that is still underway.
Okay, I will defer to my colleagues.
Okay, Ms. Delmont Small.